right, we're live. All right, guys, letting y'all come in. Is my lash is just being so weird right now. I'm sorry. 2 seconds. Okay. Wait, last check. 1 second. Y'all know y'all have to do those last checks sometimes, okay? Don't even act like you don't. All right, we're good. Hey, y'all. Hey, I almost said happy Sunday. Look, I'm not gonna lie to y'all. I just came from dinner and I had 2 glasses of wine, so I'm a little lit. So NCLEX Jeopardy is about to be fun, okay? We're about to have fun. We're about to learn a lot and have so much fun and laugh a lot because I'm a little lit. I'm not gonna lie. But welcome, guys. Welcome to NCLEX Jeopardy. It is Thursday. You already know what it is, and we have a special surprise, a special announcement coming that I'll announce only during this live. So if you miss it, you miss it. I'm so sorry. Text your girlfriend. I hope she'll share with it, but I don't know. You can only get it if you attend and watch this live all the way through. So with that being said, let's go ahead and pull up. Oh wait, I do this all the time. Y'all already know the drill. You gotta make sure our stuff is charged. Okay. All right. Now, let's go ahead and get everybody situated in. How are you guys doing this Thursday? How's your week been? I know it's been a lot going on. Congress is trying to cap travel nurse pay. It's just a lot going on in the world. But how y'all doing today? Let's go ahead and save this and open up our new NCLEX game. As you guys know, it's NCLEX Jeopardy Thursdays. Just like I revealed on my Instagram post, our categories for tonight, we have pharmacology, pediatrics, mental health, fundamentals, and adult health. Okay, so, and as you guys know, this is NCLEX Jeopardy. We are playing it Jeopardy style, so we are playing for prizes and playing for points. Okay, all right, so how we are going to do NCLEX Jeopardy is I'm going to read the question and we're going to answer choices. You guys are going to respond back and type in your answer in the comments. Because this is Jeopardy style, you have to put what is before your answer. So for example, if the answer is like number 2, the second choice, you would put what is 2. Okay, and if you're the first person to say what is 2 and you actually get it right, then you get those points and you go on the scoreboard, and that's how we're gonna play tonight's game. All right, so little tip. Okay, I always tell you guys a little tip in the beginning, but if you go ahead and type in what is in the comments or just copy and paste it, you can just kind of just copy paste real quick, save yourself some seconds because it's about to go down, okay? Especially because we're playing for prizes. All right, so let's go ahead and get ourselves situated. Do you guys have any questions? Let me go ahead and see if you have any questions before we get started. All right, I don't see any questions, so I'm gonna go ahead and pull our things up. If you guys have the Ultimate Nursing School bundle, you can go ahead and grab that, pull that out. All right, like I said, we are going over pharm, pediatrics, mental health, fundamentals, and adult health. We are going to, I really want to stress pharmacology this session, so when we go over pharmacology things, I'll just be a little bit more in depth into the pharmacology. Make sure you guys actually get that, because that's going to be our, oh, that's so great, Heels Killer. That's going to be our focus category of tonight, okay? Congratulations, Heels Killer. Thanks to you guys, I passed my T's. Yay! Now all you gotta do is get into nursing school, pass that thing. So you're one step closer. Great job. Congrats. All right, guys. So let's go ahead and get our scoreboard out. All right, so I have my handy dandy scoreboard, my handy dandy pen. This pen is included with your Nurse Life planners. Okay, it's a nice little gold sparkly pen. Makes me feel good when I'm writing. All right, so because pharmacology is going to be our focus category, let's go ahead and start with pharmacology. So let's go ahead and do farm for 300. Let's go ahead and just start in the middle, okay? All right, so like I said, I'm going to read the question. I'm going to read the question, the answer choices, and then that's going to give you guys opportunity to go ahead and put in what is and then your answer. All right, so once again, we're playing for points and prizes, so put your best foot forward, and remember that even though we're playing for prizes, that's just incentive for nurse Sam study stuff, all right? But the real winner and the real goal is to actually get the questions correct, so that when you go and take the NCLEX, you don't have any problems, all right? You remember everything that we went over on NCLEX Jeopardy, and any wrong answers that you would wanted to put, you already made those mistakes during NCLEX Jeopardy right now with us. So like I said, you can go ahead. This is practice. You know, everybody knows that during practice you have to go all out. Sometimes you might look ugly, all right? Sometimes the moves aren't hitting just yet, but this is practice, okay? That's why we're practicing, to get it perfect or close to perfect, so that when it's time for showtime, aka the NCLEX, okay, you got your moves all down, packed. All right, so pharmacology for 300. I saw you guys saying something. Oh, I love you too. Thank you, Lauren. All right, what do you have for neuro and skeletal system med surge? I will touch on that later. All right, pharmacology for 300. The question reads: a client is scheduled to have alteplase. Which item should the nurse obtain to monitor side/adverse effects of the medication therapy? Medication, once again, is alteplase. All right. Is it 1, flashlight, 2, pulse oximeter, 3, suction equipment, or 4, occult blood test strips? A client is scheduled to have alteplase. Which item should the nurse obtain to monitor side/adverse effects of the medication therapy? All right, so basically, which item should the nurse obtain to monitor the side/adverse effects of alteplase medication therapy? Is it 1, the flashlight, 2, the pulse oximeter, 3, the suction equipment, or 4, occult blood test strips? All right, let's look and see what our answer is. All right, our answer is, what is 4? What is 4? Occult blood test strips. All right, first person to get what is 4 on my screen, all right, is future ER nurse. Hey, future ER nurse, congratulations and great job. You just got 300 points, and you are now on the scoreboard. So future ER nurse is on the scoreboard with 300 points. Awesome job. All right, who else got what is 4? Melanie got what is 4, so great job. A lot of people are choosing what is 2. The nurse with faith, great job. I'm E2. Great. Aw, stop it. Thank you. All right, so this is the rationale. Okay, alteplase is a thrombolytic medication. You guys know what thrombolytic means? Thrombo, and then the suffix lytic. All right, we have a clot buster, basically. All right, thrombolytic medication that dissolves thrombi or emboli. Okay, so like I said, clot buster, clot dissolver, however you want to do it, but thrombolytic. Bleeding, right, is a frequent and potentially severe adverse effect of this medication and of this therapy. All right, so alteplase, once again, it is a thrombolytic medication. It dissolves clots. Okay, so a frequent and potentially severe adverse effect of this medication that's supposed to dissolve clots is bleeding. So basically, this medication works too well and dissolves everything, and you just have out of control bleeding, which can lead to fluid volume loss. That can definitely be a severe adverse effect of this particular therapy. Now it says the nurse assesses for signs of bleeding in clients receiving this therapy using occult blood test strips to test the urine, stool, or nasogastric drainage for any types signs of blood. A flashlight is used for pupil assessment. Okay, so that's why number 1 wasn't the correct answer. All right, it's used for pupil assessment and as part of the neurological examination in a client who is neurologically impaired. So a flashlight would be something that a tool that you would use to assess after, let's say, like a motor vehicle accident where they had like a head injury. So that's when a flashlight or a neuro assessment would be appropriate. For alteplase therapy, a neuro assessment / a flashlight, that wouldn't be appropriate for this particular medication. It says pulse oximeter, which was number 2. Pulse oximeter and suction equipment would be needed if the client had evidence of oxygenation or respiratory problems. But that wasn't disclosed to us in the problem. All we know is that the client has been prescribed alteplase therapy. And from that alteplase therapy, we should know what the side / adverse effects of that medication is. Even if you don't know what alteplase is, the fact that they gave you the class, the thrombolytic medication, all right, that should also help you into figuring out what could possibly go wrong with this medication, which is basically what this question is asking. All right, so alteplase therapy, once again, thrombolytic medication. It dissolves clots, the clot buster, and a frequent and potentially severe side effect of this medication, aka the alteplase, is bleeding. All right, and that can lead to fluid volume deficit, and they can go into shock. It's just a bunch. All right, it's a lot. So definitely bleeding is going to be something that you want to check out for and to monitor, and you do that with occult blood test strips. Okay, you're testing for internal bleeding that you can't see on the outside, basically. All right, so that was Farm for 300. Let's go ahead and do adult health. Let's do med surg for 200. All right. The nurse is teaching a client with myasthenia gravis about the prevention of myasthenic and cholinergic crises. Which client activities suggest that teaching is most effective? 1. Taking medications as scheduled. 2. Eating large, well-balanced meals. 3. Doing muscle strengthening exercises. Or 4. Doing all chores early in the day while less fatigued. Is that spam? It's gotta be spam. It's gotta be spam. Sir, what are you doing? What's happening? All right, we're just gonna go back to the question because I don't know what that message was before. The nurse is teaching a client with myasthenia gravis about the prevention of myasthenic and cholinergic crises. It has to be a scammer. Sir, leave NCLEX Jeopardy, okay? With you and your cougar girlfriend, leave NCLEX Jeopardy right now, okay? Which client activity suggests that teaching is most effective? 1, taking medications as scheduled. 2, eating large, well-balanced meals. 3, doing muscle strengthening exercises. Or 4, doing all chores early in the day while less fatigued. The answer is what is 1. It is what is 1, taking medications as scheduled. Okay, that's going to be the client activity that suggests that teaching is most effective. All right, let's see who got what is 1 first. You know who didn't get what is 1 first? The scammer with the cougar girlfriend. He did not get what is 1 first. Sir, you did not win. Okay? All right, what is 1? What is 1? What is 1? McKenna Muses. Hey, boo, hey. You are now on the scoreboard with 200 points. McKenna Muses. That's cute. 200 points? Yep, 200. Awesome job. All right, so future ER nurse in the first place with 300, and then McKenna Muses, 200 points. Let's see who else got what is 1. Bree Lively, great job. The nurse with faith, great job. All right. So it says, clients with myasthenia gravis are taught to space out activities over the day to conserve energy and restore muscle strength. Taking medications correctly to maintain blood levels that are not too low or too high is very important. Muscle strengthening exercises are not helpful and can actually fatigue the client even more. So overeating is overeating is a cause of an exacerbation of symptoms. Really? So no overeating, y'all. So overeating, once again, it can cause an exacerbation of symptoms, just like exposure to heat, crowds, erratic sleep habits, and emotional stress. Okay, so all of those can actually exacerbate myasthenia gravis symptoms. So the answer is what is one? That taking medication as scheduled is going to be, out of these choices, what alerts the nurse gave us that what we taught them has been effective. Like everything that we taught them, they have absorbed and they have comprehended. Because they said, we are going to take our medications prescribed. That's what you want them to say. Yes, ma'am. Good job. My teaching has been effective. Yay for me, and also yay for you. Stop second guessing yourself. That honestly comes with like practice, and that's like a confidence issue, honestly. But as you take more questions, and even if you are like, you know, a little hesitant or something like that, the more questions you take, the more confident you're going to get in your ability to be like, I know this answer. I don't care how they remixing the words and trying to ask the same thing over and over again. But I comprehend this information, so I know your tricks. NCLEX girl, I know it. I know your tricks. You're not going to trick me. So, yes, as you take more practice questions and really like get used to and comfortable with answering those questions, you'll stop second guessing yourself. All right, so that was Adult Health for 200. Let's do mental health for 400. Okay. All right, guys. Mental health for 400. The nurse is working a client. What? No, the nurse is working with a client who is demonstrating delusional thinking. The client says to the nurse, the leaders of a religious cult are being sent to assassinate me. Which is the best response by the nurse? 1, I don't believe that what? Oh, 1, I don't believe that what you are telling me is true. 2, there are no religious cults in this area that are going to kill you. 3, what makes you think that cult members are being sent to hurt you? Or 4, I don't know about a religious cult. Are you afraid that people are trying to hurt you? What is the best response by the nurse? All right, we have a client who's demonstrating delusional thinking. All right, and they just said to us that the leaders of a religious cult are being sent to assassinate me. What's going to be your best response to that statement of a client that has delusional thinking? All right, the answer is, what is 4? I don't know about a religious cult. Are you afraid that people are trying to hurt you? All right, so who got number 4? Who got what is 4 first? Wait for it. Wait for it. Hold on. Wait, stop. Bree Lively. Hey, Bree Lively. A lot of people chose number 3, but we're going to get into that. All right, so Bree Lively, great job. Bree _ Not gonna lie, every time I see your name, Bree Lively 07, my mind instantly, I'm ADD as hell, and my mind instantly goes to Blake Lively from Gossip Girl, and I instantly go XOXO, Gossip Girl. Just so quick in my mind. I swear I'm ADD. All right, so what is 4? I don't know about a religious cult. Are you afraid that people are trying to hurt you? That's going to be the best response. Now, it says, the nurse who disagrees with the client's delusions may make the client more defensive and actually can make them cling to the delusions even more firmly. Like, yo, you don't believe me? You don't see this cult outside? They're going to cling to that cult. They're going to cling to that delusion even more firmly, okay? So you don't want to just go ahead and basically call them a liar, because that's gonna be how they interpret it, in doubting their claims. So confirming nor denying isn't really the best way to go. I'll continue to read it. It says, it is more therapeutic for the nurse to empathize with the client's experience. Okay, so you don't want to judge, you don't want to correct, you want to restate and empathize. Okay, says the nurse can also use the opportunity to try to explore further the meaning of the experience for the client. The correct option presents reality to the client and then focuses on the client's feelings. All right, so the whole restating thing, that especially like I know with mental health, restating and almost like restating, I guess that's the word, restating the question back to them, or restating their delusion or whatever back to them. So if they, like, for example, this one said the leaders of a religious cult were trying to assassinate him. So the best response would be I don't know about a religious cult. That doesn't say a religious cult doesn't exist. It doesn't say, yo, you crazy. It doesn't say you're tripping. It doesn't say none of that. All right, it just says, I don't know. Me personally, I don't know nothing about a religious cult, okay? It's not confirming nor denying, but just saying, me, I don't know anything about it. I'm real. I'm a person in front of you. I don't know anything about it. But are you afraid? But let me further explore what you just said. He said the leaders of a religious cult are being sent to assassinate me. I don't know anything about a religious cult, but are you afraid that people are trying to hurt you? You're getting more clarity into their delusion. And who's in here too? I'm going through which else? I'm going through which. Hold on. Sir, you're being blocked. 1 second. I'm sorry. I'm sorry. We're gonna have to block this guy. I'm so sorry. I don't know what that was. Bananas and all that. I don't know what that was. All right. So, I'm E22. So I don't know if you saw before. So I can only go by my screen. Sometimes the live lags, the internet connection lags. So what you see on your screen may not be what I see on my screen. So I can only go by what's on my screen. So whoever comes first on mine is who I'm announcing. But just in case that you see some names that maybe that don't match, or maybe then there's a name that came after you, before you, whatever. I can only go by what's on my screen. So whatever I say is what I see on my screen. Okay. Did I finish that? Yeah, the correct option presents reality to the client and then focuses on the client's feelings, okay? I would have a whole conversation with the patient feeding into the delusions because I'm nosy. I've done that. I'm not gonna lie. I've done that. But I haven't carried it on. But sometimes when you ask them, like, oh, tell me more about what you're feeling, and you ask for more clarity about that delusion, it's not necessarily you telling them to carry it on. You're trying to get more clarity, and even with you asking them to, clarify that, it's you exploring, you and the patient exploring the meaning or the definition behind that delusion even further, without judgment or saying, hey, that's not, it's wrong, you're wrong, that's not there, that doesn't exist. So it's just a very it's a great opportunity to meet them kind of halfway, without, like I said, without judgment, and be able to actually see or explore deeper into what that delusion is. Okay, that lady said, I have a question. What's your question? What can make them even more scared? Confirming or denying? You're not supposed to, but let me know what you mean. All right, guys, that was mental health for 400. Quick little breakdown of our top three. We have Bree Lively with 400 points, Future ER Nurse with 300, and then McKenna Muses with 200. All right, so those are our top three right now, but it can still be anybody's game. All right, I think we have one more question to go. Let's do fundamentals for 500. Right, you're not supposed to feed in too much to the delusion, but you're still supposed to restate it. So yeah, you're still supposed to restate it. Don't feed into it too much, but still restate it, and still try to make it restate without confirming or denying, especially denying. Do not deny. Okay. All right. Fundamentals for 500. The community health nurse is conducting an education session for community members regarding measures to prevent skin cancer and is providing instructions for use of sunscreen protection. The nurse determines that teaching was effective if a community member states that chemical sunscreens are most effective when applied at what time? 1, immediately after swimming. 2, 1 hour before exposure to the sun. 3, immediately before exposure to the sun. Or 4, 5 minutes before exposure to the sun. All right, so chemical sunscreens are the most effective when applied at what time? 1, immediately after swimming. 2, 1 hour before exposure to the sun. 3, immediately before exposure to the sun. Or 4, 5 minutes before exposure to the sun. What is our answer? All right, I'm seeing 2, 3, 4, 2, 3, 4. I'm seeing a bunch of 2, 3s, and 4s. So the correct answer actually is, what is 2? 1 hour before exposure to the sun is the most effective time to apply chemical sunscreen. All right, 1 hour before exposure to the sun. And it actually says they're most effective when applied 30 minutes to an hour before exposure to the sun. So, of course, that they can penetrate the skin and actually work. All sunscreen should be reapplied after swimming or sweating, obviously to keep that protection and coverage. But yes, what is 2 is the answer. Let's look and see. What is who got this one first? On my screen. Please don't cuss me out. Bree Lively. Hey, Bree. Woo. Okay, Bree just came in and stole 500 points, and now she at 900. You go, Bree Lively. All right, Bree Lively is at 900 points, 100 points away from the Bow Wow Club. Great job. Future ER Nurse, still 300, and then McKenna Muses, 200. All right, so great job to everyone that chose what is 2. Future ER Nurse, I saw that you put 2. Vicky, Baby, Chisom, Simply Lish, Ashley, Bougie, Melanie, Mandy. Awesome job. Okay. All right. Now this is Pediatrics for 100. The clinic nurse instructs parents of a child with sickle cell anemia about the precipitating factors related to sickle cell crisis, which, if identified by the parents as a precipitating factor, indicates the need for further instruction. All right, then I'm going to read the question just one more time. The client instructs parents of a child with sickle cell anemia about the precipitating factors related to sickle cell crisis, which, if identified by the parents as a precipitating factor, indicates the need for further teaching. All right, is it 1, stress, 2, trauma, 3, infection, or 4, fluid overload? Which, identified by the parents as a precipitating factor of sickle cell crisis, indicates the need for further teaching? 1, stress, 2, trauma, 3, infection, 4, fluid overload. which, if identified by the parents as a precipitating factor, indicates the need for further instruction? All right, so the answer is what is 4? The answer is what is 4? She wears scrubs. Scott. Yes, you did. She wears scrubs. Wait, where's my pen? Oh. She. Wait, where'd you go? I lost it. She wears scrubs. Awesome job. All right, so you just got 100 points added. All right, great job to everyone that said what is 4. And not a lot of people chose what is 4 until like the end. So that's good. That's good. All right. Once again, she wears scrubs. Got it first on my screen. All right, so sickle cell crises. They are acute exacerbations of the disease, which vary considerably in severity and frequency. These include vaso-occlusive crises, splenic sequestration, that's a fun word, hyperhemolytic crises, and aplastic crises. 3, 4. Okay, so there was 4 different types of basically crises. Vaso-occlusive crisis, splenic sequestration, hyperhemolytic crisis, and aplastic crisis. All right, those are all sickle cell crises. A sickle cell crisis may be precipitated by infection, dehydration, hypoxia, trauma, or physical or emotional stress. Okay, the mother of a child with sickle cell disease should encourage fluid intake of 1.5 to 2 times the daily requirements of fluids to prevent dehydration. Okay, does that make sense? So you guys know with how I look at sickle cell, you guys know sickle cell with the red blood cell, your red blood cell is supposed to be normally a circle, but with sickle cell anemia, that circular shape is an actual sickle. It's like a boomerang, okay? And basically that boomerang, that sickled cell becomes occluded in the artery, and that's what basically causes the crisis. So the answer to this was number 4. This was fluid overload. This is letting us know that if the parents were to say that fluid overload or having too much fluid in the body would be a precipitating factor of sickle cell anemia, we would know that they would need further instruction. Because remember, that's what they asked for. It said which, if identified by the parents as a precipitating factor, indicates the need for further instruction. So we already know that if the question says that it indicates the need for further instruction, we're looking for an incorrect answer. Okay? So with this one, we're looking for the answer that's going to, we're looking for the wrong answer, basically. So what answer is going to let us know that they do not have the correct and the factual facts about sickle cell crisis down? That means they would have to tell us something that's not true. So the thing that they told us that wasn't true was number 4, fluid overload, and that's because dehydration is actually a precipitating factor, not fluid overload. And I think about it like this. Think about the blood cell as like a tube float, like at a water park. Tube float at a water park. You got lazy river tube float. And then think of the vein as like the lazy river or the tube slide or whatever. The more liquid and the more fluid that's in that slide, the easier it is for that tube, sickle cell, or that cell to travel along that lazy river or that water ride. But the less water and the more dry, the harder it is for that tube to get through and slide through the vein. So the less water and the more dehydrated a person is, the less water, or the less fluid in the vein, which means that water flow basically isn't floating no more. All right, so it's basically just going to come to a stop. It's going to occlude whatever it's, the surrounding area, and that's basically what dehydration does to the body, and how dehydration exacerbates the sickle cell crisis. It basically just dries up the body, and instead of having that float on a lazy river, that float is on just on the vein or just on the slide with no water. How are you going to have a water slide ride with no water? So the more water is added to the water slide, the more the tube can freely go about the body. But the less water, the less traveling that cell is going to do. Now, take that a step further, and instead of a perfectly round water float thing, whatever, it has like a leak in it. And now instead of that perfectly round tube, it's now like half deflated, and it looks like a crescent moon, and it's really not going. You're really not going nowhere. So that's gonna also cause an exacerbation of disease, which is another reason why the parents are encouraged to encourage the client to increase their fluid intake. Go ahead and add more water to the water park of your body so that your float can go down in your body. You don't have like an occlusive crisis. So once again, number 4 is the correct answer. All right, fluid overload is not going to be a precipitating factor. Fluid deficit or dehydration, that would actually be a precipitating factor. And then stress, trauma, infection, we already know those are precipitating factors as hell. Okay, all right. So great job. She Wears Scrubs got that one. Let's go ahead and do another one. Let's go ahead and do, what time is it? Let's do farm for 500. All right, let's do farm for 500. The nurse is caring for a client with hyperlipidemia who is taking cholestyramine. There we go. Which nursing assessment is most significant for this client relative to the medication therapy? All right. So 1, yes, you're saying what is. It's still NCLEX Jeopardy. You have to say what is and then the answer. Yes, the nurse is caring for a client with hyperlipidemia who is taking cholestyramine. Which nursing assessment is most significant for this client relative to this medication? 1, observe for joint pain. 2, auscultate bowel sounds. 3, assess deep tendon reflexes. Or 4, monitor cardiac rate and rhythm. All right, so the nurse is caring for a client with hyperlipidemia who is taking cholestyramine. All right, so the cholestyramine, the first like 6 letters definitely looks like cholesterol. So just by looking at this medication, you can tell that this medication, and from the sentence, you can tell it is a medication used to treat clients with hyperlipidemia. So with that being said, we have a client taking this medication for hyperlipidemia. What is the most significant for this client relative to the medication therapy? The answer is what is 2, auscultate bowel sounds. All right, let me go back to it. All right, so the answer is what is 2, bowel sounds, auscultate bowel sounds. Let's see who got number 2. Bree Lively got it again. Bree Lively is on it. Bree Lively, you just got another 500 points, love. That just brought your score up to 1,400. She Wears Scrubs, you was right below her, boo. Yeah, that just brought your score to 1,400. If you didn't get it first, it's okay. As long as you got what is 2, you should feel amazing. All right, it says cholestyramine is used to treat hyperlipidemia. What I said. What did I say? Even if you don't know it, try to, figure out the name, especially for pharmacology. This is a pharmacology tip. Pay attention to the prefixes and the suffixes, okay, and root words. Those will help you. Okay, those will help you figure out what that medication is, or that's going to be as much help as you're going to get besides from like the content from the question. But let the name help you in figuring out what the function of that medication is, or what the actual diagnosis is for that medication. But the cholestyramine, like I said, the prefix of the word looks like cholesterol, so that made me think, okay, this medication is for cholesterol management, aka hyperlipidemia, and it is. The site of action of this medication is the bowel, all right, which is why you had to auscultate bowel sounds to make sure. Well, that's why auscultating bowel sounds is one of the most significant assessments for this particular medication. It's because the site of action is actually the bowel. So you just want to take a listen, make sure we don't have any, make sure we have bowel sounds, and note them and assess them as well. All right, it says, since the site of action of the medication is the bowel, option 2 is correct. The remaining options are all unrelated assessments. So observe for joint pain, assess deep tendon reflexes, and monitor cardiac rate and rhythm. Those are unrelated to hyperlipidemia. Okay. Oh yeah, I just got 2, 3. What internet you got, for real? That's so funny. Great job, guys. Let's go ahead and get into let's do fundamentals. All right, it says fundamentals for 400. All right. The nurse received a telephone call from the post-anesthesia care unit stating that a client is being transferred to the surgical unit. The nurse plans to take which action first on arrival of the client? Is it 1, assess the patency of the airway? 2, check tubes or drains for patency? 3, check the dressing to assess for bleeding? And then 4, assess the vital signs to compare with preoperative measurements. I'll read that once again. The nurse receives a telephone call from the post-anesthesia care unit, aka the PACU, stating that a client is being transferred to the surgical unit. The nurse plans to take which action first on arrival? 1, assess the patency of the airway. 2, check tubes or drains for patency. 3, check the dressing to assess for bleeding. And then 4, assess the vital signs to compare with preoperative measurements. All right, let me look and see what y'all are saying. All right, the correct answer is, what is 1? What is 1? Look at that. Amaya. Hey, Amaya. All right, so you are on the scoreboard with 400 points. Great job. All right, so let's go ahead and go over the scores really quick. So we got Bree Lively in first place with 1,400 points. I don't know what internet she got, but break us off some. So great job, Bree. You're in first place. Second place is actually Amaya. She just came in and just got the question right. She's actually in second place. Amaya got 400 points. And then third place is, so far, is future ER nurse with 300 points. And then we have Makana Muses with 200, and She Wears Scrubs with 100. And that's our scoreboard so far. All right, like I said, we still have 15 more minutes. It still be anybody's game. Like I said, Amaya just answered that question correct, and she's already in second place. So, awesome job. Wait. Okay, let's go over. All right, let's go over the rationale. All right, it says the first action of the nurse is to assess the patency of the airway and respiratory function. Remember your ABCs. All right, if the client's airway is not patent. The nurse must take immediate measures for the survival of the client. All right. The nurse then takes vital signs, followed by checking the dressing in the tubes or drains. The other nursing actions should be performed after a patent airway has been established. Okay. So, yeah, make sure your patient's alive and breathing. Okay. Alive and breathing. That and is so important. That and is so important. Assess that airway. All right. Just make sure the airway is patent and open. And then you can do everything else. All right. So just for ABC, A for airway. All right. Literally go there first. You're like, hey, how you doing? Say I'm just kidding. All right. Now let's do. Let's do pediatrics for 300. No second guessing. All right, pediatrics for 300. The clinic nurse prepares to administer a measles, mumps, and rubella vaccine, or MMR, to a 5-year-old child. The nurse should administer this vaccine by which method? 1. Subcutaneously in the gluteal muscle. 2. Intramuscularly in the deltoid muscle. 3. Subcutaneously in the outer aspect of the upper arm. Or 4. Intramuscularly in the anterolateral aspect of the thigh. All right, so they are giving us method and location. One says subcutaneous method, a sub-Q method, in the gluteal muscle. 2 is intramuscularly in the deltoid muscle. 3 is subcutaneously in the outer aspect of the upper arm, like back here. And then intramuscularly in the anterolateral aspect of the thigh. Anterolateral. Oh yeah, it's over here. So what is our answer? What's going to be the method and location by which this nurse administers MMR vaccine to a 5-year-old child? The answer is what is 3? What is 3? Subcutaneously in the outer aspect of the upper arm. All right, it says MMR vaccine is administered subcutaneously in the outer aspect of the upper arm. The gluteal muscle is not recommended for injections. MMR vaccine is not administered by the intramuscular route. All right, so off rip, we should have went ahead and eliminated 2 and 4 because it's not given intramuscular. It's not given as an IM injection. It's sub-Q. All right, so 2 and 4 are out. You know it's sub-Q. It's either going to be in the gluteal muscle or the outer aspect of the arm. And since the gluteal muscle is not recommended for injections, that leads us to number 3. Well, subcutaneous in the outer aspect of the upper arm. Boop, 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 boop. Okay. Also, I have 2 kids and never have I ever seen that. What, the MMR vaccine or just them giving it in the MMR vaccine? I mean, them giving it right here. Oh, also, if you guys need a little, for the pediatric immunizations, the McDonald's themed, fast food themed immunizations, pediatric immunization schedule that we have, that is available in the Ultimate Nursing School bundle. If you guys don't already have that, but that's an awesome pediatric immunizations resource if you need to know what ages and what vaccines pediatric patients get when they're born. All right, so I'm going to let you guys in on this little secret. All right, this is the announcement that I just want you guys to know. Let me go read my bundle. Okay, awesome. So if you guys don't already have the bundle, just because you guys are here with me tonight, I'm only announcing this on this live, and it's only going to be until midnight because y'all are here with me, so that means y'all actually heard it in time. But if you go ahead and use code LIVE50, LIVE50 on my website, you can actually get the Ultimate Nursing School bundle for 50% off, and the ATITs bundle, and the Critical Care Nursing School kit. So yes, Critical Care, Ultimate Nursing School bundle, ATIT study bundle, all 50% off tonight only, just because you came to hang out with me for NCLEX Jeopardy. All right, so that is my gift to you, Live 50. All right, that's actually going to be open and available until midnight. So make sure you guys take advantage. All right, now don't go sharing this code because everybody else couldn't come to the live. You showed up on the live, you did what you're supposed to do, you understood the assignment, and you came to the live. All right, so you get the code Live 50, and you're right here. Live 50 for 50% off digital products. Well, the ATITs and the Ultimate Nursing School bundle. All right, so yes, ATITs, Ultimate Nursing School bundle, and the critical care, because the critical care study kit is by itself. It's not with it's going to be in actually volume 2 of the next study bundle. So we capped volume 1 at 400 pages. So everything afterwards is going to be put into volume 2, which we are starting. So critical care will be in the second volume, but you can still get it if you use code Live 50 for 50% off. All right. So making sure you guys get that little tidbit. I think I said tidbit. It's supposed to be tid with a D. Okay. All right. Once again, Live 50. Live 50 is your code. Hold on, wait. Live 50 for 50% off. And off. These bundles. Okay, and now I'm gonna pin the comment. Okay, good, cool, now we're good. All right, so I just wanted to share you guys that little code with you. You have until, like I said, midnight Eastern Standard Time to take advantage of that code. So please do so if you don't already have that information. All right, now let's go ahead and get back. Let's do adult health for 4,000 again. All right, I said 4,000. I'm at 400. I had wine, y'all. The nurse is caring for a client admitted to the hospital with suspected acute appendicitis. Which laboratory results should the nurse expect to note if the client does have appendicitis? 1, a white blood cell count of 4,000. 2, a white blood cell count of 8,000. 3, a white blood cell count of 18,000. Or 4, a white blood cell count of 26,000. Did y'all hear that? No, ma'am. The sky is angry. All right. Which laboratory results should we expect to find if the client does have appendicitis? Remember, this is NCLEX Jeopardy. Put what is. Is it 1, a white blood cell count of 4,000? Is it 2, a white blood cell count of 8,000? Is it 3, a white blood cell count of 18,000? Or is it 4, a white blood cell count of 26,000? What is going to be our answer? All right, our answer. Oh, this is petty. The answer is what is 3? What is 3? Who got what is 3? Who got what is 3 first, I should say. Wait, who got the last one? The person who got the last one was Amaya. Amaya got the last one. And Amaya got this one. You go ahead, Amaya. All right, so congrats, Amaya. Amaya's the first one to correctly get what is 3. So an extra 400 points for you, Amaya, which literally just took you to 800. You just came in, you answered 2 questions, and now you're already at 800 points. You go, girl. All right. So Bree Lively with 1,400, Amaya with 800, and then Future ER Nurse with 300. That's where we are right now. Making the Muses is 200, and then She Wears Scrubs is 100. Let's get into why this is what is 3 and not what is 4. Because I'm not gonna lie, I was gonna choose what is 4. I would have chose what is 4. But let's go ahead and figure out why. I thought it was the flushing. All right, let's look and figure out why. All right, laboratory findings do not establish the diagnosis of appendicitis. Did you guys know that? Laboratory findings do not establish the diagnosis of appendicitis, but there's often a moderate elevation of the white blood cell count, leukocytosis. That's the word it's called. But that moderate elevation is between 10,000 to 18,000. All right, with an increased number of immature white blood cells. An inflammatory process causes a rise in the white blood cell count. You guys know that's our immunity defense. A rise to 26,000 may indicate a perforated appendix. All right, so anything greater than 20,000 can further, can actually signal like that it's a perforated appendicitis. So if it goes, that the white blood cell count goes above that 18,000, it's more likely severe. It's more than just inflammation at this point. All right, so we know that inflammation is going to cause that rise of the white blood cell count of the appendix from between 10,000 and 18,000. All right, anything over 20 is more than inflammation and a situation. So more than 20 is going to be most likely your perforated, your burst appendix, basically. So 10,000 to 18,000 is suspected acute appendicitis. Above 20,000 may indicate a perforated appendix. All right. Let's see. Live 50 is the code. Ultimate Nursing School bundle is the bundle with all 3. All right. All right, good. Give that person a time. Let's do one more. I want to do another farm for you guys. All right, this farm is for 200. This is the last one. The nurse is monitoring a client who's receiving epoetin alpha for adverse effects of the medication. Which finding indicates a side or adverse effect? 1, diarrhea. 2, depression. 3, bradycardia. Or 4, hypertension. We're monitoring a client who's receiving the medication epoetin alpha. All right, epoetin alpha. We're observing them for adverse effects of the medication. So which finding would indicate an adverse effect or side effect of this medication? Is it 1, diarrhea, 2, depression, 3, bradycardia, or 4, hypertension? All right. The answer is, what is 4? Hypertension. What is 4? Hypertension. Who got what is 4 correct first? Future ER nurse. Great job. All right, so future ER nurse. That's an extra 200. All right, so you just got an extra 200 points added to your score, so that brings your score up to 500. All right, it says epoetin alpha generally is well tolerated. The most significant adverse effect is hypertension, and its use is contraindicated in uncontrolled hypertension. Occasionally, a tachycardia may occur as a side effect, but this medication may also cause an unproved sense of well-being. Oh, I was like, why did they throw that one in there? It's to answer number 2, basically. Number 2 was depression. So we know that depression isn't the correct answer, because it says apparently this medication may also cause an improved sense of well-being. I didn't know it doubled as an antidepressant. All right, we are getting red blood cells and dopamine. And we're getting happy. Okay, we're getting our happy chemicals. Okay. All right. So once again, eplein alpha, generally well tolerated. All right, but the most significant side or adverse effect is that hypertension. And obviously, if hypertension is a significant adverse or side effect, we know that it's going to be contraindicated. Okay, we should not give this medication to somebody that has uncontrolled hypertension. Why? Why would you give it to somebody with uncontrolled hypertension when you know a side effect could be even more uncontrolled? All right, so it's definitely contraindicated, prohibited from clients with uncontrolled hypertension. Okay. They also said that tachycardia may occur as a side effect. Question: do you guys know the difference between a side effect and an adverse effect? Can someone please tell me? Does someone know the definition of does someone know the difference between a side effect and an adverse effect? Who can tell me the difference between an adverse effect and a side effect? Look at what you guys are saying. All right, so this says the main difference between side effect and adverse effect is a side effect can either be harmful or beneficial, while an adverse effect is typically harmful and undesirable. All right, so also the adverse effects are typically more severe and life-threatening. So adverse is definitely the bad one. Yes, adverse is complications, side effect, Great job, awesome. Side effects is what you can expect to happen, and adverse effects is what is unexpected and a little bit more serious. But yeah. And it's also important to note that side effects can either be harmful or beneficial. All right. Adverse effects, those are harmful. Those are harmful. All right. So just an example of a side effect: nausea, diarrhea, vomiting. Literally side effect. But an adverse effect would be something like liver damage, something like that. Like an adverse effect of this medication is like something, like I said, harmful, undesirable, and can actually, be life-threatening. So something like, liver failure or something like a kidney failure, that would be like an adverse effect. An adverse effect of taking too much Tylenol, it's liver failure. An adverse effect of taking too much NSAIDs, your kidney's gonna be fucked up. All right, so great job, guys. Awesome job. Renal stenosis. Ooh, good one. That was a good one. Anaphylaxis. That's yes. No. The main one. The main adverse effect. Is death an adverse effect? I think death would. Death is definitely the worst adverse effect. Okay? That happens as a result of everything else. All right, guys. That was... Who did I say got that? Let me go back up. Literally just saw it. literally just on. Wait, what? Amaya. Amaya, you just got 200 points, right? Wait, hold on. It was future ER nurse. I lied. Sorry, Maya. Yeah, it was future ER, my bad. All right, so guys, that was the end of our questions. Let's go ahead and figure out who won tonight. Let me go back. Yeah, it's future ER nurse. Okay, wait for it. I'm scrolling. Yeah, ER nurse, got it. My bad, I love you. So sorry. All right, so our final 3 winners, okay. We have Bree Lively 07 with a wonderful high score of 1,400 points. You better listen. Second place is Amaya. All right, great job, Amaya. You have 800 points. All right, you were so close to 1,000, girl, but you listen. You came in and you answered 2 questions and got second place. You get it, girl. All right, so great job to Amaya. Second place with 800 points. And then third place, we have future ER nurse with 500 points. So congratulations to Bree Lively, Amaya, and future ER nurse for winning. You guys did great. So proud of you guys. All right, so you guys won study gummies. All right, so perfect for you guys to take with lion's mane. It's a nootropic AAA smart drug. These support focus, memory, mental clarity. It's great to pop 2 either before you go to class, before you log on to your Zoom class, or before you go to clinical, or before you take your exam. These have been getting great reviews. All right, people have been saying, look, before you go and get on Adderall, try study gummies with Nurse Sam. It's a great herbal. It's herbal. All right, this is not Adderall gummies. Okay, this is an herbal dietary supplement made with lion's mane. That's a nootropic, lion's mane, and that's going to naturally support your focus, your memory, your motivation, get you really ready to do some work. All right, and cross some things off your to-do list and really stay mentally clear as possible. All right, so study gummies, you just take 2, strawberry flavor, has a bit of like a cinnamony like aftertaste, but that's the spice behind it, is really just the taste of the lion's mane, but that quickly dissipates back into that strawberry flavor that I was telling you guys. Tastes delicious. Okay, take 2 per day. Take 2 before you take an exam or start studying or doing whatever you do that you really want to get more clear and focused and motivated. So this would be a great supplement for you guys. All right, available online and an app, and you 3 just won a free bottle. All right, so Bree, Amaya, and future ER nurse, if you guys can DM me your full name, your email address, and your shipping address, I will go ahead and ship this out to you guys tomorrow. All right, guys. Once again, live 50. All right, for 50% off the Ultimate Nursing School bundle and the ATITs bundle. So just in case you didn't get the 60% off sale from before, from earlier last week, you have another opportunity to get 50% off. All right. The name of the gummies is Study Gummies. Right on my website under accessories, on my main page as well. But yes, all right, so make sure you guys send me that information. I will see you guys next week for, if you're gonna come to ATITs Tuesday, I'll see you Tuesday. If not, I'll see you guys next week Thursday for another episode of NCLEX Jeopardy. All right, you guys have a nice night. See you later.